I'm going to be talking about intravenous, intramuscular, and subcutaneous injection. Firstly, we have intravenous injection. Intravenous injection, this type of injection are made into mostly the cubital vein. They are also made into veins of the forearm, veins of the hand, and veins of the foot. They are administered in situations where there needs to be fast absorption of the medication or fluid being given. So indications hereby include administration of medication, fluid, blood, and blood products. There is also collection of blood. The contraindications include extremities with renal fistulas, veins that cross over joints, nerves, injuries, and large vessels and also in areas where there are presence of lumps and nodules. Complication of intravenous injection is divided into systemic and local complications. For the local complication, it includes thrombosis, phlebitis, and infiltration. Local complications affect the area where the injection was made, while systemic complications affect the whole circulatory system. Systemic complications include pulmonary embolism, allergic reaction, catheter embolism, hematoma, and systemic infection. Air embolism could also occur, which is due to the presence of air bubbles inside the injection mixed with fluid before injection was made. Next is the intramuscular injection. Intramuscular injection is given in the case of sedative administration, analgesic administration, example analgesics like morphine. It is also given in vaccination and given as antibiotics. Contraindications include in patients with hemophilia, coagulopathy, in shock, and myocardial infarction. The complications of intramuscular injections include post-injection abscess, muscle necrosis, adipose tissue atrophy, dermatitis, and damage of neighboring structures. Example is nerves. For here and in this picture here we can see the sites for intramuscular injection administration. Firstly, we have the deltoid muscle, which is located at the upper arm. Then we have the vastus lateralis and rectus femoris. We have the dorsogluteal region, but it is not recommended because it is quite close to the sciatic nerve and there could be damage of sciatic nerve. We also have the ventrogluteal region. In intramuscular injection, the type of needle which is used is a green needle. It is 8 to 10 centimeters in length and it is given at an angle of 90 degrees to the muscle. The last injection includes subcutaneous injection. Subcutaneous injection is given for medications which needs to be absorbed slowly. For example, in patients with diabetes mellitus, there is administration of insulin and coagulant in patients with coagulation disorders. The contraindication of subcutaneous injection include burns, open wounds, emergency cases, large volume of drugs, and malnourished person. So subcutaneous injection are not given over areas where there are burns, open wounds, and it is not given in large volume of drug because this medication is absorbed slowly and in malnourished person due to not enough subcutaneous tissue present. Complications of subcutaneous infection of subcutaneous injection include swelling, redness, pain, tenderness, thrombus formation, and allergic reaction. And you can see the sites of subcutaneous injection administration. Anteriorly, it is given at the upper arm, the lateral aspect of the upper arm. It is given in the abdomen, at the umbilical region, and on the thighs. And posteriorly, it is given at the upper arm, at the back and lower loins. In subcutaneous injection, the color of the needle is orange, and it is 50 to 70 millimeter in length and 45 degrees. It is given at an angle for 45 degrees to the skin. Thank you.